Hi, thank you for joining us again today. I'm Natasha Brantley. We're joining you from CHRISTUS Good Shepherd in Longview, and we have an exciting offering of information for you today. So we're here in our normal newborn nursery, and our focus today will be about the baby. So we're going to go over a lot of the things that you can expect to see in the hospital and tests that they will perform on the baby. We'll also go into a brief overview of info you need to know about your birth certificate process. And we'll also, at the end, wrap up with some car seat safety tips that are very important for you to be mindful of when you're picking out a seat and making those decisions. So we'll get started. I have joining me today Gabby. She's one of the nurses on A200 Postpartum Mother Baby Unit. And so she's going to tell you info about your baby.
So when you first get here, you will start out in labor and delivery. This is where you will sign all your paperwork and get ready to deliver your baby. So some of the things the nursery nurse will talk to you about is the vitamin K injection, the erythromycin eye ointment, and then the hepatitis B vaccine. These are typically given while you are over there, after your baby's born, of course. So the vitamin K injection is important. It's an important of the body's ability to clot. I am so sorry. Is it okay?
Yeah, for teaching.
Okay. For teaching purposes, I'm going to take my mask off. That way you can understand me a little bit better. I'm not sure how this is coming across on the computer. When you are up here, we will all have our mask on. We will have our safety goggles on, so that everyone is safe. So babies are born with just a small amount of vitamin K in their bodies because it does not cross the placenta well. Without the appropriate amount of vitamin K, although it's rare, babies are at risk for up to the first 6 months of life developing vitamin K deficiency bleeding. So we give this shot within 2 hours after you have the baby. We give it in the left leg, and then the hepatitis B vaccine goes in the right leg. That's just so that we know. It's just a common practice for us, so we know which shot went in each leg. The recommendation is for the infant to receive a one-time shot of vitamin K in their leg to boost their vitamin K levels. Risk of the vitamin K injection or pain and minimal bleeding at the site. Bruising is rare. I haven't seen a lot of baby thighs with bruising, but it can happen. And so the erythromycin eye ointment is used to prevent the risk of a potential serious eye infection in the newborn that can lead to the baby having eye problems such as corneal scarring, ocular perforation, or even blindness. It's a thin layer of eye ointment. We give you the first hour with your newborn so you can see your newborn as he or she is when they are born, and then after about an hour to an hour and a half, we add the eye ointment, so they'll have a thin film across their eyes. It will absorb into their skin, so it will not be there forever, maybe a few hours. The risk of the eye ointment are minimal, and it may include mild irritation and sometimes swelling. And the hepatitis B vaccine is optional. We strongly encourage it, but it is optional. Hepatitis B is a contagious liver disease. The infection from hepatitis B can range from a mild illness with no symptoms to serious illness requiring hospitalization. Infants usually show no symptoms. The shot is given in the opposite leg of the vitamin K within the first 12 hours of life. The risk of the vaccine may include low-grade fever or soreness of the injection site, and again, also mild bruising. Okay. We also will do a first bath if that is what you would like. It doesn't matter to us. We can do the first bath here. You can do it at home, whichever you're more comfortable with. We do the bath 4 to 6 hours after birth as long as the baby is stable. So as long as the temperature is 98 degrees or greater, if the baby is on blood sugars, which we'll get to that in a minute, but if the baby has blood sugars, as long as the blood sugar is stable, we will do the bath. If it is low, your baby will not be bathed because that would drop the blood sugar even more, and we would have to send the baby to NICU. So some babies, if there are risk factors for bath, which is a low temperature, low blood sugars, your baby, it could be 12 to 24 hours before we bathe the baby. And that is just if the baby is just unstable, not ready for a bath. We can do the bath in the room if you want, whichever you prefer. We can do it in the room or in our nursery area. You can help with the bath. Dads can help with the bath. I have had, well, we can't have other family members help with the bath now, but you or your support person can help with the bath if you are able. We'll help you through it, and we'll just show you how to do it. Okay, we will do a wait at delivery, and then we do a wait with the bath, which is typically within the 6-hour time frame, and then every evening. So we will, some nurses will do the wait in the room, and I believe some do it in the nursery. I work day shifts, so I typically don't know the routine on that. It's expected that your baby will lose weight within the first 2 to 3 days of life. They have extra fluid they need to get rid of. But as your baby increases the amount of feedings, if they can tolerate it, they will start to gain their weight back. That typically happens within the first 2 weeks. We also, part of the newborn care is for us to check your baby's jaundice levels. Jaundice is the yellowing of the skin. And so we check the baby's transcutaneous bilirubin. It's a little light on the head or the chest. We do either one to see what the level is. We start it at 12 hours of life, and we do it at 4 and 4. If we notice or suspect there is an increase in jaundice or bilirubin, or we just see, hey, this baby's a little more yellow, we can check it a little bit sooner. And then we'll get in contact with the doctor to see what we need to do. The bilirubin is what is left over after the red blood cells die off or are damaged, and jaundice is a very common occurrence. Most of our babies go home with mild jaundice. The baby is not able to process the bilirubin as an adult would. If your baby has bruising from delivery or a traumatic delivery, there's an increased risk for a higher bilirubin, which is the jaundice level. Okay. So if we do the little light, the TCV, that's our short term for that. If it's elevated, we will be in contact with the doctor or per our policy, and sometimes we have to do a heel stick. We have to do a little poke on the baby's foot and draw some blood to get a more accurate level. If the level is above a 12 to 13 on the little billimeter, that's typically going to be in the high risk zone, and we automatically draw the blood, and then when we get that result, we report it to the doctor. Okay. Another part of our routine newborn care is a newborn hearing screen. We have someone who comes to the room, gets you to sign a form to say that you are okay with them doing that. They do it in the room. If there is a lot of noise in the room, sometimes we have to bring the baby to the nursery. Every baby's different, so they may be able to do it in 2 seconds flat. Some babies, they just require a little bit less noise in the room, and so we would bring your baby to the nursery. We do have babies that refer. It is common for babies to refer because there are debris left in the ear from delivery. There's fluid in their ear. So if your baby refers, it does not mean your baby is deaf. It's a possibility, but we get you to bring your baby back in 2 weeks to do a repeat hearing screen.
What does refer mean, Gabby?
If the baby refers, the baby does not pass. Sometimes it's one ear, sometimes it's both ears. So the hearing screen technician would schedule you an appointment to come back in 2 weeks. That gives your baby plenty of time for the fluid to resolve, the debris to clear, and you would come back here to this floor. You would come to our nurse's station, check in, and we would get with the hearing screen technician to see where you guys would go to do that hearing screen. If there was another refer, the hearing screen technician would schedule you for another appointment. And they would do that. They could possibly do that here. Sometimes they would have to send you to either Dallas or Shreveport to get a different form of test. We're not going to go into all of that because it happens, but it's very rare. Okay. And so another part of our newborn testing is a CCHD, which is a critical congenital heart defect testing. This one is non-invasive. It is very, very important because we have actually caught several babies that have had congenital heart defects they were not caught in utero during the ultrasound. So we actually monitor for this throughout, like from birth to discharge. Some of the symptoms of a congenital heart defect is the baby's breathing fast, which is tachypnea. They have a blue discoloration. Every time we come in your room, we are looking at your baby. We are making sure your baby looks good, breathing good, the color looks good. So we are always checking for a congenital heart defect, whether you realize it or not, because every time we come in the room, we're looking at your baby. And we complete this test after 24 hours. So if you deliver at 10:10, we're going to do it after 10:10 the next day. The same with the newborn screen, which I'll get to that next. 3% of babies have birth defects, and 1% of those are heart related. And so this test is very, very important. It's a pain-free test. We measure the oxygen in your baby's blood. So we use let me grab a pulse oximeter real quick. We put a little pulse oximeter on your baby's hand, and we put one on the foot. And we put the baby on a monitor, and we just wait until the baby's calm. We see what our numbers are. We check the heart rate. We check the respiratory rate. We listen with the stethoscope so that we can actually listen to the heart sounds. If a negative screen means your baby's oxygen level is normal, the respiratory rate is within normal limits, as well as the heart rate. So there is nothing else we do. A negative screen means the baby passes, but we have to document a negative screen. So a positive screen means the baby's oxygen level is not normal, which we would be below 95% in the nursery. We would call the doctor at that point. Sometimes the doctor says repeat the screen in an hour, and then we'll go from there. Sometimes the doctor says let's go ahead and order an echocardiogram. We would do a sonogram of the heart. The tech would come into the nursery and do the ultrasound. And then once that is completed, they send it to one of the cardiologists. Most of the time, the baby I would say 90% of the time, the babies are still here when waiting the echo results. If a congenital heart defect is suspected, we, of course, would not send your baby home until the echo results are back. They don't always come back within an hour. If it's an emergency situation, the cardiologist calls us on the floor, the nursing staff, and then we call the doctor, or we put them in contact, and we go from there. And this test may not recognize all heart problems, so you do need to notify your doctor if your baby is not eating well, tires easily while eating, if your baby's breathing fast, breathing harder than normal, does not wake up easily, if there is a discoloration, a blue color, any of those things, you need to call your doctor. We do see some of these symptoms in babies here, but there are times that it is not picked up here and it happens at home. So any of those symptoms, you need to call the doctor. Of course, if your baby's blue, you need to call 911 and get the baby checked immediately. Okay, so our newborn screening test, this one requires a little poke on their heel. So when we do our heel sticks, a lot of moms not a lot of moms, but they don't like their babies crying, so we use a heel warmer. So if you are here and you see this, I don't know if you can see it that well, we just pop it, put it on the baby's foot, and we wrap a diaper around it. So this warms the heel. This helps with pain. I've done a lot of heel sticks, and when I use the heel warmer, a lot of babies like it better. They don't seem to cry or get aggravated as much when we poke their heel. Not every baby is like that. So look at there, we have a little baby. Okay. So this is what we do. We keep the baby in their crib. If you are more comfortable nursing your baby, I sure don't mind doing the newborn screen on your chest so the baby can nurse. Just get the diaper out so I can show you what we do. So we just pop it, put it on here, wrap the diaper around the foot, and we give it a couple minutes to warm up. So if you see a crumpled up diaper, it is not dirty. It's because we used a heel warmer and we needed a diaper. So we just keep that on, take it off, and then these are our little heel stickers. We clean the foot, poke it, and then this is what we do. We sit here, we fill up these 5 little spots with blood. And the babies tolerate that pretty well. We keep them swaddled up. Someone can hold, someone can help soothe and pacify, whichever you want to do if we do it in the room. We do typically take these babies to the nursery and do it, but if you want everything done in the room, you just have to let us know and we will do that. Okay, so the newborn screen, we highly recommend this because a lot of these disorders you do not see. You can't physically see in the baby. We just see a happy, healthy baby. Sometimes your baby could have a disorder and we would not know. So we do this first test after 24 hours, and then the second test is 7 to 14 days at the doctor's office. If they are found early, they can prevent serious illness, intellectual developmental disabilities, illness, or potentially death. So we highly recommend these. I told you about the 2 different times. So we have a little form we get you to sign as well. So we'll take this off. We'll give this form to you to sign. This lets the state keep the blood spots. If you say okay, they will keep them for 25 years. They'll use them for potential research. Everything's confidential, so if your baby's blood spots cures anything or solves anything that they are working on, you will not know. If you say no, the state keeps the blood spots for 2 years and then they discard them. Okay. And a lot of our babies, I said I'd talk about blood sugar checks. A lot of our babies get blood sugar checks, and some of the reasons why are because the mom is diabetic, gestational diabetic. So we check the baby's blood sugars for 12 hours. Also, if the baby is large for gestational age, we have a little graph that we do a gestational age assessment on, and if your baby's weight is above the 90th percentile, we will do blood sugars for large for gestational age. If your baby is teeny tiny, which I know the numbers don't mean anything, but if your baby's less than 2,500 grams, we would do blood sugars for 24 hours. If your baby is a late pretermer, which is 35 to 36.6 weeks, we will do blood sugars for 24 hours as well. So you'll see us warm the foot quite a bit. We'll do little pokes. We'll do those blood sugar checks. At that time, or anytime, we'll discuss feeding options, but we will really want the babies to breast or bottle feed, whichever is your preference, kind of on a schedule so that we can keep up and do the blood sugars every 3 hours. And if you need help feeding any baby, it's very important you ask for help, because you may act like you've got it and think you're doing okay, and you probably are, but we want to be there to help you position your baby. We want to give you the confidence you need so that when you go home, you feel very comfortable breastfeeding or even bottle feeding. So at any point, if we aren't asking you about 500 times if you need help, you need to ask us for help. That maybe that one time we don't ask you if you need help. I'm rambling, I'm sorry. Okay, and then car seat testing, they're going to go over that in a little while, so I'll just kind of do a brief overview. If your baby is less than 37 weeks or less than 2,500 grams, your baby will get a car seat test done. We do this test for 90 minutes. If you live further than that, that is something we discuss with the doctor. We've had people that are driving longer than 4 hours, and each case we talk to the doctor about. So if you do live further than that, it could potentially be a longer test.
Why do we do that test, Gabby?
We do this test so that we will know that the baby can breathe well. We do not want the baby's oxygen level dropping, and we do not want the heart rate dropping. So we put a pulse oximeter like we do on the heart testing. We put this on the hand or the foot. We put a cardiac monitor, and so we watch the baby. We get over here, I do vital signs about every 15 minutes. Do vital signs, we do a heart rate, respiratory rate, and then the oxygen level to make sure that the baby can tolerate being in the car for a long period. We do recommend when you go home that if your baby will be in the back seat, we recommend someone sitting in the back seat with your baby on the ride home. If you have a boy, you have the option to have a circumcision, or for the baby to have a circumcision. We will ask you at any time. You may get asked before you have the baby. You will get asked several times on our side. We will get the consent signed. We'll go over all of the risk factors. It is optional, so we will never pressure you to do it if you don't want to. You just tell us no, and we'll be done with it. The doctor that delivers your baby will do the procedure. It's completed in the nursery. We do hold the baby's feeding a few hours prior to the circumcision so that your baby will not be at risk. We don't want the baby to spit up during the procedure. If it does happen, we have a bulb syringe, but that's why we hold off on the feeding for a little bit. The baby some doctors do EMLA, which is a numbing cream. We put that on the penis about 30 minutes to an hour prior to the circumcision. Some doctors do that, and then some doctors do a lidocaine injection that they will do that at the procedure time. We also give Toot Sweet, which is kind of like sugar water. We do that to help pacify the baby while the baby is being circumcised. We actually try to give it about 5 or 10 minutes before the procedure because it does help calm them down. We swaddle them up for the circumcision. We did it different many years ago, but the babies seem to tolerate that better, tolerate being swaddled better. The doctors give the chance for the lidocaine to work. I help with a lot of circumcisions, and our doctors are very good. They give the medication time to work. So they'll do the injection if they use the injection, which all of them do. We only have a few that do both. But we give the lidocaine injection time to work, and we just kind of sit and wait. And the doctor makes sure that the baby's not going to cry before he does anything invasive. If the baby starts fussing or anything, they typically wait, give it a few more minutes, and then we start. We do have babies that sleep through the procedure, and most babies tolerate it really well. After the procedure, we will go over with you how to care for it. Most babies, most doctors do the Gomco or Mogan, which I'm sure unless you've researched it, that is just the device the doctor uses. We will teach you how to care for it afterwards. We do Vaseline and gauze. So when we bring your baby back to the room, we will do the circumcision teaching. Sometimes we do it before the procedure, but we want you to be comfortable with that as well. So the first diaper change, we do recommend you call us. That way we can also do another check, make sure there's no bleeding. We send the baby back with no bleeding. If the baby's bleeding, the baby will stay a little bit longer, and we'll talk to the doctor. If the baby has a little bit of bleeding, the doctor uses a little silver nitrate stick and stops the bleeding. So we discussed that with you after it happened. So sometimes there's just a tiny little black dot where the bleeding was. We typically do not give any Tylenol or the circumcision. Most babies tolerate it well. Our main concern, of course, is helping you change it, watching for bleeding, and then the baby's feeding. Some babies come back and they want to eat like a pig. Some babies are just pooped out and they wait a few hours before they want to eat.
Can I bathe my baby after the circumcision?
We would recommend having assistance with the bath. If we do it in the room, we want to keep the diaper on. We want to keep it tight. We don't want to do it right after the circumcision. I would recommend waiting a few hours before we tried to do a little sponge bath. The risks are the most common are bleeding, bruising, infection at the procedure site, improper healing, adhesions or reattachment of the foreskin requiring another procedure. So when you see your pediatrician will tell you when it's time for you to start pulling the extra skin down. We don't do it immediately after the circumcision. We typically wait until the circumcision is healed. Okay, and the newborn photographers, we are limiting the people we have come to the hospital, so they will not be here at this time, the Mom 365. If you need us to take pictures, we are more than happy to take pictures with your personal camera, your phone. We can help assist in pictures as needed.
All right. So thank you, Gabby, for going over all of that helpful information about our babies. Next up, we have a lady that will be familiar to many of you that have joined us in the past, but we have Paula Height, and she's going to go over some helpful information that you will want to know about the birth certificate process.
Hi guys. I know in the past I've come to talk to you about breastfeeding, but I also help to coordinate some of our birth registration here at CHRISTUS Good Shepherd. So one of the most exciting pieces you get to do when you welcome a new baby is you guys get to choose the name. But there is a little bit of paperwork involved. There are some things that have to get accomplished for that name that you've chose to become your baby's legal name. So there's different scenario that you look at when you're looking at which papers you're going to need to complete for your baby's birth certificate. You're going to receive a folder in labor and delivery, and I know we've talked about that folder before, and there is tons of different papers and forms and great information for you. Some of the papers that you'll see in there will be the parent's birth certificate worksheet. This is like a 4-page form that you're going to fill in, and it's going to ask you your current name, your maiden name, which is the name that's on your birth certificate, Mom. It's going to ask you information about where you were born, what's your address. It's going to ask some health information that the state requires. It's also going to ask information about the father of your baby. So when we look at choosing information on what to include on your birth certificate, there are some very specific laws in place that we are governed by when we help you set up your birth certificate. If the mother and the father of the baby are legally married, then they will complete a birth certificate that includes mother and father. In legalese, the spouse of the mother is considered the legal father of the baby, or the presumed father of the baby in the state of Texas. In some cases, the mother is not legally married to the biological father. So then there's a choice that mother and father need to make. Mother can choose to list herself and her baby on the birth certificate and not immediately list the father of the newborn. There are some reasons why mothers choose this. They're very personal reasons, and not my job to get into your business, right? So if the mother says to me, I just want to list me and the baby on the birth certificate, then that's the way we're going to help you set your birth certificate up, because it's your choice. If mother says, well, I'm not married to my baby's dad, but we want to list him on the birth certificate, there is a process for that. The Office of the Attorney General here in the state of Texas is who controls those acknowledgments of paternity. You'll hear us shorthand by saying AOP, but acknowledgement of a paternity is the legal method that the parents use to say, I'm the mom and he's the dad. So we call this father who is not married to mom the biological father. There are some processes that must be put in place to create that legal agreement. We're going to assist you with those processes while you're here, and then we're going to send this information electronically through to the state so that then that paternity can be established for dad. The one other issue that you have to think about is maybe mom was previously married, or mom is currently married, but the father of the baby is not the spouse. There's also a process to complete that type of birth certificate. If the mother has been divorced or from her spouse for more than 300 days, which is approximately how long you're pregnant. Basically, if you got divorced before you conceived your pregnancy, then you can designate, along with the biological father, his name on the birth certificate, as long as he also comes and signs your birth certificate. If the mother is still married, or if the mother has been married within that 300 days, then the state is going to require that the presumed father, this is the husband of the spouse of the mother, he's going to also need to sign the paperwork. So it will require the three of you to sign papers: mother, the biological father, and the presumed father, which was the mother's spouse. Now, don't get worried. You guys do not often have to be in the same room together. We understand that some family separations are very congenial, and we also understand that some family separations are not very congenial. We will make sure that if you are needing that type of birth certificate where an ex-spouse is required to sign off, we can make arrangements for that to be done completely separate from the family that has just had the baby. So we will be very accommodating to help you in those situations. So if you're needing an acknowledgement of paternity type birth certificate, there's several things that have to be checked off the list as we go ahead and get that set up for the state. There is a video that mother and biological father need to watch together that is produced by the Office of the Attorney General. It goes over the legal rights and the legal ramifications of signing the paperwork. We, as your birth registrars, go through some very specific training through the AG's office so that we can act as an agent for their paperwork. We will have to ask you certain questions to confirm you feel comfortable and understand the information you've provided. We will witness your signatures as a legal representative of the facility. We will make certified copies of that paperwork for you so that it can basically become a legal document without you having to actually be present in a courtroom, which is where legal documents normally start out. The other things that are very required: the biological father will need to present a legal form of identification. There's a pretty long list of what qualifies as a legal form of identification. Most present a driver's license or a state ID. Some of the other things that we have had presented, military IDs, birth certificates, IDs from other countries. Very often we have identification papers from Mexico or from other countries. Also, you can have identification papers that would include things like school IDs. If you're unsure if you have an ID that is going to meet the criteria, all you have to do is ask the birth registration clerks. They're going to be coming to your room. They're going to be picking up your paperwork that you've completed. They're going to be asking if you have any questions. They are going to ask you if you and the baby's father are currently married, or if there was a previous spouse during the pregnancy, so that they can help you figure out which birth certificate you need to complete, which one's going to be the best for your family, so that we can make sure we get all of, those T's crossed and those I's dotted. Once you complete your paperwork, and we're going to ask you to do that during that evening after you deliver, or within that first 24 hours after you deliver. Certainly you can complete it sooner. I have had some mothers who actually, for a long, prolonged induction where they're like looking for something to kind of take their mind off the labor process, they're actually sitting in there completing paperwork in labor. Whatever works for you. Then you will turn those completed forms into the birth registration clerk, who will come to your room to pick those up. We will then take them and we'll type them into a computer station that we have set up to communicate with the state's computer system. We'll get it all completed, and then we'll bring it back to your room to let you review it, because we acknowledge we're human and we do make typos. And so we want to give you the opportunity to proofread every single word that we have typed in, every single number that we have typed in. Basically, I tell moms, look at it square by square, and if you find anything that is not correct, tell us right then and there. Let us correct that for you, so that everything that goes to the state is 100% accurate on your behalf. Once we get your signatures on those forms, then we will take and make you copies, so that you'll leave out of here with copies of everything that you've signed for your birth certificate. That way you will also have some reference numbers where you can call the birth certificate people in Austin if you have questions. You can call back to us. You'll usually get me if you have questions. You can call the Attorney General's office if you have questions about paternity paperwork. There will be lots of resources for you. You can call Gregg County's birth certificate department. There's plenty of folks who can help you. The other thing to think about is your time frame. I have a lot of folks that tell me, I haven't picked a name for my baby. You do have, by law, 5 days to decide when you want to complete your baby's birth certificate. We're going to encourage you to have that name documented and your paperwork complete before you leave here. Worst case scenario, you get ready to go home and it's still not to your liking. Then we can make a time, an appointment for you to come back up here, but it has to happen before the baby is 5 calendar days old. That's a state law that we need to adhere to on your behalf. Anything else you can think of that we should say about birth certificates?
When will I get the birth certificate?
Oh, excellent question. Thank you. Yes, the birth certificate leaves us electronically, goes to the state. Several different pathways for your birth certificate. It's going to go to the Social Security Administration. It's going to go to Medicaid. If your baby is going to be a Medicaid participant, it's going to go to the Attorney General's office if you're going to be needing their services, and it's going to go to the state registrar. It typically takes somewhere between 4 to 6 weeks for that information to make it through all of the channels to be certified and approved, and then it will come back digitally to the Gregg County Courthouse. In years past, you had to go to the courthouse where your baby was born. So if you were born in Gregg County, you had to go to Gregg County Courthouse. Nice thing about our new digital age is that you can actually electronically request a copy of your baby's birth certificate, or you can go to any courthouse in the state of Texas to request a copy of the baby's birth certificate if you don't live here in Gregg County. There is a $22 fee for each certified copy of the birth certificate, and you can get that now, and I strongly recommend you get one and make sure that everything has been correctly transmitted through the state. But say 5 years from now you can't find that copy, don't fret, don't panic. You can still go order another one if you need one. It will be there for the rest of that child's life. The Social Security card will come to your house in the mail. So that's why we want to make sure that mailing address is 100% correct for you, because you're going to get the baby's Social Security card in the mail, and if your baby is a Medicaid participant, you're going to get your baby's Medicaid information in the mail to that same address that you provided on the baby's birth certificate.
Okay.
All right. So if y'all have any questions, problems, if you have things you need to clarify before you come to the hospital, feel free to call and ask for birth registration. We can help you, walk you through your individual circumstances if you need us. Thanks, Natasha.
Thank you, Ms. Paula. All right, next up, we're going to help you through some information that's important for you to know about car seat safety. So we know that car seats can be an intimidating thing. Trying to figure out what type of car seat I need, how do I install it, which way does it need to face. So we have a few things that we've put together to help you in deciding some of these things. I have with me my partner today, Miss Linda. She is a nurse here in the neonatal ICU, and she has had some very in-depth training on car seat safety, and we have some things we want to share.
Okay. And there's 5 key things to doing when you do car seats. You need to select the right car seat for your baby's age, the baby's weight, the baby's height, and the baby's developmental limitations. And we're talking with childbirth, we're more than likely looking at a newborn infant. And there's 2 different selections that you can do, which is your infant rear facing only. It usually comes with or without a base. And the other is a combination seat, which can be rear facing, but it is installed in the car, and it does not usually have a handle with it. It stays in the car, and it can then be turned forward facing as the baby grows. The second thing that you need to make sure is that you know how to use the car seat. So don't pick one that's too complicated for you, because you will have to use the car seat correctly each time that you give it to the baby. You want to make sure that your car seat fits in the vehicle that you have. There are car seats that just don't fit in a vehicle. You want to make sure that
Car seat
instructions. Yeah, you want to make sure that you know where the car seat instructions are, because a lot of car seat they're going to refer you back to the not only the car seat manual, but the vehicle owner's manual. Okay. You want to make sure that if a car seat was given to you, that you know the history of the car seat, that it wasn't in a automobile crash, that it is not expired, and that it is in good use, that it doesn't have any cracks or chips in it, and that has all of the pieces, the harnessing and the clips that secure the child into the seat. You also want to check and make sure that that particular seat has not been recalled, and you can go to a website.
We've provided it in their chat box, those websites, they can see it online. So if you'll take a look in our chat section, we've provided 2 websites there for you that will tell you, you can plug in information about your car seat, and they'll let you know whether or not your car seat has been recalled.
As far as your newborn infant, it is recommended that they are rear facing. The American Academy of Pediatrics recommends that all infants be rear facing until 2 years of age, or they outgrow the rear facing car seat that you have. Most of these infant only rear facing are up to about 20 pounds. And then you should then transition your child to a combination seat that is also a rear facing. That can then be turned forward facing as the child grows. Let's see. Okay. The next thing that you want to do after you select your car seat is to know the location that you're going to put the car seat in your car. Not all car seats will fit in all seating positions in your car. So your owner's manual of your vehicle will tell you which ones are appropriate for the car seats. Things that you need to make sure of is if you have the latch system, which is the lower anchor and tether child attachment system, that there are posts underneath the seats, and you can tell that there's a latch system because there is usually an indicator on the back part of the seat, either a dot or a icon marking. And each post can only take one piece of a car seat anchor.
I'm going to try and attempt to share my screen, Linda, so that I can show them a photo of it. I tried to pull up a photo before we started.
Okay.
Okay.
Okay. Where the arrows are pointing is your lower anchor bars. And so one of your latch system or one of these will go into each of those bars. There's usually one on each side of your car seat. You got to know how to get them in and out. That's learning your car seat. So one of these goes with each arrow, and it clicks in place, and then it will keep your base secure. You do not need to use then your car seat belt if you have the lower anchors anchoring this car seat into a seating position. To know that your car seat is secured, the base is secured in there, once the anchors are tightened, you can wiggle it holding over the anchors, and it shouldn't go back and forth or front and back more than 1 inch. If it does, you need to tighten your anchors. And that goes into positioning, which we'll touch on a little bit later. But so the position is make sure that your car has either a appropriate seat belt or the latch system for that particular part. The next is installation. And that goes into with the latch system or the seat belt. If you're going to use the latch, we've just demonstrated it. If you're going to use the seat belt, you need to put the base in the forward facing position. You need to bring the seat belt all the way over, thread it through the belt path, and click it into the seat belt attachment. You need to pull the seat belt all the way down till you hear it click, and then you need to push it back in as it will. You'll hear a ratchet sound, and as it clicks back in, then you want to push down and make sure that that seat belt is tight as you're pulling that shoulder belt up. Once it's tight, again, you're going to want to make sure you don't have any more wiggle than 1 inch front, back, or side to side. So now that we've got our base in, you're going to want to then make sure that you know how to put the baby into the car seat. Okay. So I'm going up to my car seat, and I cannot put my baby in the car seat when he is wrapped in a blanket. So you must unwrap the baby. If it's in the winter time and excessively cold, make sure that they have long pants, socks, and long shirts and hats on as you put the baby in the seat, and then you can cover them with a blanket after you have installed them and harnessed them in. Okay, come here, back, baby. Also know your car seats, because the seats have adjustable harnesses, and this one has a button. If you push, you pull the seat out, and this becomes very loose. Then when you undo it, you unclick. Then these spread out. Some car seats actually have little hooks for you to hold it. I don't think this one does, but you hold the belts out. You put the baby in. You want their little behind all the way into the back of the seat. Then you bring the straps over. The positioning of these straps should come from underneath the baby's shoulder. If the belt comes from above the baby's shoulder, he can slide out if there's an impact. So make sure that the belt position, the hole that the belt is underneath the shoulder so that it comes up and over the baby's shoulder. So you want to put both of those in, and then this one is a 5-point. So you'll want to find all the pieces and click in the bottom part. And the babies are wiggling, so it sometimes takes a minute to get these babies in these. And then you're going to click in the part on it. Now this is also called a chest plate, and it should be placed at the area of the baby's armpit. Once you get this clipped, then you want to pull the strap and it will tighten. Okay, whatever. Baby's holding on to it. There we go. Okay, so now I've got it tightened. How do I know that it's tight? We use what we call the pinch test. And the pinch test is you should not be able to do this, where it is pinch and hold both sides of it. If you can pinch the webbing, then it's too loose. So you want to retighten until you can't do a pinch. And now I can't pinch after I've retightened it. Okay, so it's coming up over his shoulders. This is at the armpit level, and all of the clips are clipped. Okay, you do not want to put any inserts into the car seat unless they came in the package with the car seat. Any what they call aftermarket products may invalidate the warranty of the car seat in the event that your infant is in a crash in the car seat. So use only the products that came with the car seat. Okay, so now that we've got the baby there, we look at what the base in the car. We also have to look at if it's got the right incline and slope. So in your car seat base, when you put it in, let's see. This is on the side of your car seat, there is usually an indicator that says this must be level with the ground. So when you put it in the base, that must be level with the ground. And so you have adjusters that allow you to do that. So this one went from not level with the ground to level when I used this adjuster. And that's so that he is in the proper position. Also on the side of this car seat, you will see a little dial, and it slides back and forth if he's in the wrong position. So right now, I'm in the, where am I? Is it centered? Okay. All right. So, but if you're up here like this, that's too much. Your baby's head could tilt forward, and that is too much. It would keep the baby, could possibly slide out in the event of a car crash. That's why it's important to not only get the line correct, but get the indicator correct. So now the baby is in the car seat with the proper harnessing, the proper installation, the proper direction. And he's ready to ride. I think that was,
Yeah, I think you've covered a great deal of information. So some of the things that Miss Linda went over that you'll want to remember is there's several different things you should consider when you are looking at car seats. One, you want to consider your selection, making sure that you are picking out a seat that meets the weight requirements and is also aligned with your vehicle's manufacturer instructions, and you install it the way your seat instructions say. You'll also want to make sure that we're dealing with an infant when you leave the hospital, that the baby is rear facing. You also want to make sure that you are putting the baby in the appropriate place in seating in the car. And Linda explained that your car manual instructions will give you idea of what is appropriate for your vehicle. She also went over some helpful hints with installing the car seat in the car, and also how to harness and strap the baby in. So that information is very helpful. And again, we've put for you in our chat box some helpful links for you to go on if you need additional information about car seats. If you want to find out if a seat that's been given to you is still appropriate for use, or if it's been recalled, we have that website there for you and available as well. So we hope that you found the information we provided today helpful and useful, and we look forward to seeing you again. We will have another broadcast next week on Thursday, the same time, 10:30. And also would like to direct you to our Good Shepherd Longview website for previous postings of the past sessions we've recorded and put there for you. So we thank you for joining us today and look forward to meeting with you again. You ladies stay safe. Thank you.